So, these very sort of normal behaviors. There's probably other environmental things, honestly, that we're not yet measuring or able to measure, just given the rate of acceleration. When I talk to my colleagues who are oncologists, things like plastics or other things that we don't yet know, it's clearly something in the environment that is driving these increased cancer risks.
So even at this sort of level, if I'm drinking, that might be 1 unit, right?
Yes, so
That'd
that
be
would be 1
7
unit. So
units a week.
that would be fewer than 14 of that. So you could see like if you had double that, it would be a decent pour of wine. You could not have more than 7 of those in a week to be in low risk. But even drinking that amount, your risk of breast cancer would go up a little bit.
Even this amount.
hmm There's really sort of no safe amount of alcohol when it comes to breast cancer.
Is it just breast cancer?
So that low risk category, so when these big cancer studies categorize people as sort of low risk or light drinkers, moderate or heavy. And for pretty much every cancer, once you get to the moderate category, we start seeing increases. And there's what we call a dose response relationship. So the more you drink, the higher your risk of cancer. There's only a few cancers that the risk seems to increase even at that very low level. And breast cancer is one of those. And then esophageal cancer is one of those. So there are certain cancers where even a small amount of alcohol will increase your risk.
Does it have an impact on thinking about cancers that are prominent in men?
Yeah. So colon cancer, we're seeing that in a lot of young men. Liver cancer, yeah, prostate cancer, which is obviously a male cancer, we don't think of as much as being sort of an alcohol-sensitive cancer, but most cancers, because the way alcohol impacts your risk of cancer is not really on a specific organ outside of the liver. It's really about how it changes our DNA. So it's about inflammation and what are called reactive oxygen species that sort of change our cells and increase the risk over time of the mutations that lead to cancer.